Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Hearing from your doctor that you may need to have an MRI scan might leave you feeling a little bit anxious. MRI stands for magnetic resonance imaging. It's a non-invasive way for your doctor to examine your organs, your tissues, your skeletal system, your bones.
Head to
most
toe.
Important part of your body.
That's right.
It produces high-resolution images of the inside of the body. And it's absolutely amazing technology that can help diagnose all kinds of problems, and there's no radiation.
Anxiety for patients can come from fear of feeling claustrophobic in the MRI machine or worry about what that scan might show. Here to give us a crash course in MRI 101 is Mayo Clinic radiologist and division chair of body MRI, Dr. Phillip Young. Welcome to the program, Dr. Young. It's nice to meet you.
Thank you very much. It's a real pleasure to be here.
Dr. Young, great to have you on the program because we've never really covered this topic, or at least not very well. Magnetic resonance imaging. There are magnets in there.
Yes, you bet. The machine itself is a very powerful magnet, and we use that magnetic field strength and radio waves to extract powerful images of patients' insides.
So radio waves and a big magnet, because you have to be very careful about going into this, the area of the machine with anything metal on your body, right?
That's true. The fact that it's a magnet does pose some potential safety concerns, and so we actually have an MRI safety committee that really reviews all of our policies on a regular basis. We screen patients ahead of time, and if patients have concerns, they can always call ahead and ask ahead of the appointment.
What's the difference between an X-ray, a CAT scan, and an MRI?
So X-rays and CT scans use photons, and that causes some radiation to the body, whereas MRI uses magnets and radio waves to extract that information.
And there's no radiation involved, because if you have enough CT scans over a period of years, there can be some concern about the amount of radiation your body receives, right?
That's true. There's at least a theoretical concern that with ionizing radiation, as you would get with X-rays or with CAT scans, that the cumulative dose can eventually cause some problems with your DNA. That's not a concern, at least to current medical knowledge, with MRI.
Are there some contraindications? Are there some patients who can't have an MRI for whatever reason?
There are a handful of patients, particularly as I alluded to before, with certain types of implanted devices where either we cannot do them or we can only do them under certain very controlled circumstances. And so we have special procedures in place to allow us to do those and involve our MRI physicists. We monitor the way that the scanner works in those cases and sometimes interrogate medical devices before and after the procedure.
Why, when I get my MRI, does it ask if I've got tattooed eyeliner?
Well, some sorts of tattoos have metallic pigments in them, actually.
So a regular tattoo, no, but an eyeliner tattoo, yes?
You know, I can't say specifically for the eyeliner tattoo, but certainly some of the red tattoo has iron in it, for example. Oh. And I'm not actually familiar specifically with eyeliner tattoos, but there are specific types that can be something we have to consider in terms of MRI safety and screening.
I know one of the problems that you have, and my patients have sometimes been unable to have an MRI scan because of claustrophobia. It's very close in there. So I'm wondering how common that is. And also, there are some institutions, and I don't believe you have any here, the open MRI scan where you're not in the tube.
Yeah. So if you think about it, the MRI scanner is shaped like a donut, and the imaging takes place with the patient inside the hole of the donut. And so that sort of confined space can be claustrophobic for patients. Now, at Mayo Clinic in Rochester, we'll do somewhere in the order of 100,000 exams this year. And it happens a couple of times a day that a patient has some problem with the claustrophobia or the closed space. There are a couple of things we can do for this. We do sometimes give patients a small anxiolytic medication as they come into the scanner to reduce some of the tension.
What kind of? You mean like a tranquilizer?
Exactly.
Or
it's a very
anti-anxiety medication.
Very mild sublingual under your tongue medication to sort of take the edge off some of those nerves. Okay. We also have larger diameter scanners where that inside of the hole of the donut is bigger. So the standard size is about 60 centimeters. And we've invested a fair amount in the larger diameter bore scanners that can fit either larger patients, for one thing, or they're less enclosed feeling. And more patients feel like that extra 10 centimeters buys them the ability to get through an exam more comfortably.
It was always my impression also that the open one, where you just kind of go into it and it only half around you, doesn't give you as good a pictures.
There are a number out there, and our experience in the past with the open scanners has been they really haven't met what we feel is our standard of quality that we would really like to see.
Why are they so loud?
Yeah, it has to do with the way the machine works. There are very powerful gradient switches that are going on in the setting of a magnetic field. There's been a lot of effort recently to try to reduce that noise.
Really?
And we do have some newer technology that reduces the noise, and we try to be conscious of patients' hearing as well. So we generally give patients earplugs to try to improve the comfort of the exam. And if patients are uncomfortable at any point during the exam for any reason, claustrophobia, the noise, or just not comfortable with the time something's taking, we always give them a squeeze ball where you can essentially squeeze it and ask for help, and we can pull you out and talk about it and figure out how to proceed.
Would you believe I've fallen asleep in my MRI before?
Not me.
More than once. More than once I have.
I always fall asleep in the scanner.
Yeah. How do you prepare a patient for an MRI? And I suppose that depends on what they are having MRI'd.
Yeah, I think that if patients have specific questions about the type of MRI, they can certainly address with their doctor or call us in radiology ahead of time if they'd like some more information. We try to give patients information in what's called the PAG that they get ahead of time. One thing to know is that the scans are variable in their length. They can be as short as a 40-minute appointment, and they can be an hour or 2 hours or longer, depending on the complexity or the number of body parts we're trying to scan at one time. One of the most important things that patients know is that their cooperation in holding still can make a big difference in terms of the quality of the exam as it comes out. And we try to be very communicative between the technologist and the patient about how to optimize the quality of the exam as we're acquiring it.
Are there any side effects that patients need to worry about? Any potential problems? Any long-term complications of having an MRI scan? Have you ever seen any?
So generally, no. Like I said, there are some safety risks in patients, particularly with certain devices.
Like a pacemaker?
Yeah, that's one sort of example, and things like deep brain stimulators and other devices as well. There are too many for any individual patient to try to keep track of. So we devote quite a bit of effort up front trying to manage the risk and reduce it and screen for patients who have any potential issues ahead of time.
I would imagine if you're doing something like a leg, like the whole length of the leg, it can take a really long time. Or can you take bigger movements in between each picture?
Yeah, every patient's different and every problem is different. So sometimes longer or more body parts do take longer, but for example, you could image in the long plane as well to try to get information all in one image. So there are different ways that we handle these problems. When we scan 100,000 patients a year, we spend a lot of time trying to figure out the best way to handle all sorts of complex problems.
And the exams are much faster than they used to be.
They certainly are.
How many scanners does Mayo have?
About 40.
40. Unbelievable, 100,000 exams a year.
And we're scanning from 6:45 in the morning till 9 o'clock at night, and then we certainly have people on call and available 24 hours a day, 7 days a week, 52 weeks a year for all the complexity of practice our size can see.
Is there anything that people should know about what to do after the MRI is completed?
Generally not. The reports are generally out within a business day or so. The patients can check with their doctor if there's anything sooner coming up. That we try to accommodate patients who have surgery on short notice and those sorts of issues all the time.
All right, no problems post-op. It's pretty amazing. Amazing.
It is.
You've had how many?
I've lost track of the number that I've had. And that's the last thing I was going to ask. If you have so many that you can't keep track of how many you've had, are there any side effects of that?
So no,
good.
Actually.
Yay.
So they've had you do 100,000 a year, 99,000 a year plus Tracy.
That's right.
MRI scans 101 with the chair of body MRI at the Mayo Clinic in Rochester, Dr. Phillip Young. Thanks so much for being with us.
Thank you.
And that's our program for this week.